Good evening. I'm going to give a brief introduction into antitrypsin deficiency, also known as alpha-1. How many of you have a family member that has a chronic breathing condition such as COPD or emphysema? Well, it could be possibly a link to antitrypsin deficiency that has never been tested. Unfortunately, testing for alpha-1 is a fairly new diagnosis and has only been tested for the last 25 years. Only in the last few years, using the alpha-1 testing procedures has been getting more popular with doctors since they've been more educated on the condition. 2 years ago, I was diagnosed with alpha-1, tested and diagnosed with alpha-1 as a carrier. I am currently undergoing infusions for it. Being treated for alpha-1 antitrypsin deficiency and receiving a protein infusion called prolactin C augmentation therapy. The first thing you need to do is talk to your primary physician about the possibility of having alpha-1. The test is very simple and is done by a blood test. And most insurance companies will cover this test. The test will determine if you are a carrier or full alpha-1. If you're a carrier, it means you have one bad gene, and if you're a full alpha, it means you have two bad genes. According to the Alpha-1 Foundation website, you have three testing options. One through your doctor, one through the University of South Carolina, which is a free test. They send you a test packet, you prick your finger, you send the test back to South Carolina, and they mail you back the results letting you know if you're a carrier or a full alpha. The other is through the Florida Department of Health Services, and they do the testing for free at one of their facilities. One of these tests will let you know if you have alpha-1, which then you will determine the correct course of action. Once you have determined that you are an alpha-1 carrier or full alpha, your doctor can then decide the best treatment option for you for this condition. There are a few treatment options. The treatment options I personally I take a prolactin C infusion weekly at home. I also have to take 2 long-lasting inhalers. My infusion is done at home by a home health care nurse. The infusion takes about 2 hours from start to finish every week. Per Grifols Pharmaceuticals, which is the manufacturer of prolactin C, there are multiple different infusion medicines that you can take. The other medicines are dependent on the specific conditions of the alpha deficiency. The other medicines are used for some of the liver conditions that are associated with alpha-1 and the lung conditions. Once you started your treatments, you will be required to continue these infusions for life, since there's no permanent cure. There are lots of services and support out there for alpha patients through AlphaNet. While you're being treated, you will be assigned an alpha coordinator. Your coordinator will touch bases with you every month, checking on your infusion supplies, your medicine, and any health issues. You will talk with your coordinator about anything. They can give you all additional information, testing, and all of that you need. They'll also refer you to the Big Fat Reference Guide, which is published by AlphaNet. And that has all the important information and additional information for you and your family. They're kind of the middleman between the pharmacy and the patient. I hope I've explained the general knowledge of alpha-1 to you and the treatment options that are available. I've given different options on how you can be tested on the condition, and the next time you go to your doctor, you can ask them if you should be tested for alpha-1. Thanks.